Good afternoon and welcome everybody. My name is Brigitte Rose and on behalf of Lung Foundation Australia, I'd like to thank you for joining us for today's webinar, presented in collaboration with the Centre of Research Excellence in Pulmonary Fibrosis. I'd like to start by acknowledging the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures and to elders past, present and emerging. Today's webinar will focus on cough and breathlessness in pulmonary fibrosis and include some practical tips on managing these symptoms, as well as a demonstration of airway clearance techniques. Before we begin, there is just a few housekeeping points to run through. The first one being this webinar will be recorded, so if you do need to leave at any time or wish to refer back to the content as an ongoing resource in the management of your lung condition, then you can certainly do so. The recording will be hosted via LFA's YouTube channel, and if you've registered for the Pulmonary Fibrosis webinar series, you will automatically receive a link to this recording via email as well. Secondly, I will just let you know that a Q&A session will be held towards the end of the webinar, so we really encourage you to submit any questions you might have for our guest speaker via the Q&A box. You can access the box at any time during the presentation, so please feel very welcome to ask as we go. It won't interrupt the presentation whatsoever. I'll just make a note of your question and direct it to our speaker during the Q&A segment. You can actually submit your questions anonymously too, so if there's anything you do want to ask without identifying yourself, you can certainly do that too. Now I'd like to welcome our speaker for today, Amanda McNulty. Amanda is a senior physiotherapist in pulmonary, cardiac and chronic disease rehabilitation at the Royal Prince Alfred Hospital in Sydney. Amanda is with us today to share her insight and practical tips on managing cough and breathlessness and to touch on airway clearance techniques. I'll now hand over to you, Amanda, if you'd like to please share your screen with everyone joining us today.
Thank you everyone and good afternoon. And thank you very much for joining us for the webinar today. And thank you to Brigitte for the nice introduction. So our topic for today's webinar is going to be all about managing breathlessness and cough, and also covering airways clearance techniques for people with interstitial lung disease. And why we've chosen these two symptoms is that for a lot of people with ILD, they can cause a lot of issues and also impact your lives greatly. And hopefully through the webinar today, we will be able to share with you some skills in how you can manage and gain control of these symptoms rather than the symptoms controlling you. So we'll get stuck straight into it. So firstly, I'll go through a bit of an overview. So we're going to be talking about why you might be having breathlessness. We're going to be covering management strategies for your breathlessness. We're going to touch on the benefits of pulmonary rehabilitation and how this can help in managing some of your symptoms like breathlessness and cough. Then we're really going to delve into why you might be getting a cough, some of the management strategies for cough, and like Brigitte said, we're going to talk about airways clearance and also give you a demonstration on how to perform that. And then we will leave some time at the end for questions. So definitely jot down anything or leave it in the comments box and hopefully I can answer it for you after the talk. So firstly, we're going to talk about why you might be feeling or experiencing breathlessness. And we know that breathlessness is one of the most common symptoms experienced by people with ILD, and it can be experienced in varying degrees. People with ILD report a general reduced exercise capacity or an inability to perform usual activities without breathlessness. And it is particularly noticeable when walking up hills or climbing stairs, so on exertion. With ILD, there is scarring of the lung tissue, which can slow down oxygen intake into the blood. And it is hypothesized that this can contribute to the symptom of breathlessness. We also know that weakness of muscles can also cause you to feel more breathless, and we're definitely going to come back to this point later on in the talk. So like I said before, with ILD, parts of your lungs will have some fibrosis. And you can see here in the diagram we've got two cross sections of lungs, the one at the top being a normal lung, and then the one at the bottom being a lung with ILD. So in technical terms, fibrosis means thickening or scarring of the tissue. And in this case, the normally thin, lacy walls of the air sacs, which you can see in the top diagram, that is what we would expect in a normal lung. But with pulmonary fibrosis, the lungs are no longer thin and lacy, and they develop this thick, stiff and scarred area of tissue, which you can see in the bottom diagram. And this is known as the fibrosis. With this scarring, the architecture or the makeup of the lung gets stiffer and less efficient in the ability for the oxygen to come into the bloodstream. And in addition, the stiffness or fibrosis of the tissue makes it more difficult for you to expand your lungs and breathe. And it takes more energy to breathe, and this additional demand of energy can lead to shortness of breath, where activities that were usually easier can become harder. But what we also know is that breathlessness is far more complex than just the damage that's within the lung, and that it is influenced by a lot of other factors as well. And these other factors are what we're really going to focus on today, because those are the ones that we really can change and what we can see improvement and help to manage our breathlessness. So I thought this was a really nice diagram because it shows some of the other factors that can influence our breathlessness. If we have a look at the breathing domain in the top left-hand corner, within this domain, we know that breathlessness patients experience a sense of needing more air, and therefore they may consciously or subconsciously increase their rate of breathing. And this is predominantly using the upper chest and the muscles around your neck and shoulders to help you breathe. And what we know is that these muscles do get tired quite easily, and whereas breathing from lower down using our diaphragm is actually much more efficient. But unfortunately, the inefficient way of breathing using that upper chest can further increase the work of our breathing, and it can intensify our breathlessness. If we look over in the thinking domain in the top right-hand side, we know it's well recognised that anxiety or fear caused by breathlessness can in turn further increase the perception of breathlessness, and that this vicious cycle can lead to a rapidly escalating sense of panic, which most breathless patients have experienced at some point. And we're definitely going to be touching on this section and really talking about anxiety as we progress through the talk. And then finally down the bottom is our functioning domain. And this is something that a lot of you can probably relate to. We know as breathlessness is so unpleasant, it is natural to avoid it by reducing the activities that cause you to feel breathless. However, inactivity leads to muscle deconditioning with reduced efficiency in using the oxygen. And then on top of this, family members and other carers or loved ones sometimes can further worsen this by trying to help through doing activities that the patient might have otherwise once done. And this can compound that cycle of inactivity. And we're definitely going to be talking about this a little bit further along in the talk as well. But if we think about these factors of breathlessness, there are elements within each area that can be changed and that we can address to improve the management of breathlessness. So that takes us into the next part of our talk through some strategies that we can put in place to help our breathlessness. And the really positive thing is that there is a lot that you can do to help. So firstly, we're going to mention quitting smoking. And why we mention this is that, you know, if you are currently smoking, we know that reducing and aiming for smoking cessation is one of the best things that you can do. We know that smoking can increase the risk of further damage to your lungs and create further progression of your breathlessness. Another point is taking your medications as prescribed by your lung doctor. And some of these medications, for example, could be puffer. And some of these medications we know can optimize our lung function. So it is important to use them as prescribed. And also, if you have been prescribed oxygen, this can be really helpful, especially for exercise and for activities, as it can reduce the demand on the body and hopefully help with the breathlessness as well, if that's something that your doctor has deemed useful. So the next point that I wanted to mention is about pacing. And this is quite a tricky one for a lot of patients that I've noticed in the past have been quite fast or have been a bit of a rusher it's sort of prior to their lung disease, because it's very hard to change habits. But we know that adjusting the type and speed of activities can help patients manage breathlessness. Most of the time, performing an activity a little bit slower than usual may be enough to control the breathing rate and reduce the demand. If breathlessness is unmanageable, you want to stop, recover, and then restart at a slower pace. Another good tip is conserving energy. And sometimes this can be by picking a time of the day best for you for the more tiring activities. For example, some people are morning people and they have most of their energy earlier in the day. And then you may decide to pick those things that you find difficult. It could be shopping, it might be cleaning the house, it might be having your shower. And picking that morning where you feel the best of the day, that's probably a good idea. There are some people who actually find as the day progresses, they start to pick up in their energy levels. And that might be a good idea to pick the afternoon for your more tiring activities. And then lastly, with pacing, another tip is what we call staging activities. And what this means is dividing tasks into smaller bits. For example, for showering, you might stage your shower by first gathering your items, having a rest. Then you may sit down on a shower seat to conserve energy through the shower. You may wash your body, have a rest. You might do your hair, have a rest. And then you may even use, and I know some of our patients have reported this is quite helpful, like a toweling dressing gown that you can just wrap yourself in to help dry your body rather than going through the motions with a towel, which can take up even more energy. So next we're going to talk about positioning. So what we know with patients that have breathlessness, using an arm-supported forward lean position can assist with the recovery of breathlessness. And why this is that the muscles around your shoulders and your chest that support your arms, when they're relaxed and supported, they allow you to help you breathe. And that forward lean position actually allows your diaphragm, that efficient muscle of breathing, to be in a more advantageous position. And what we also know, and you may have noticed yourself when you go shopping, you really like to take the trolley. And basically that's going into this forward lean arm-supported position. And it might mean that you can go for longer with your shop without getting so exhausted or breathless. And what we've found that's really helpful for patients in terms of exercise training is actually using a walking frame. Obviously, you may not need it for balance, but it's actually allowing you to walk for longer without getting so exhausted or out of breath, so you can really build your endurance. And here's just a few pictures of what this position might be in sort of slightly different postures. And you can see there are two here utilising a chair in sitting, and then you may not have a chair at the time, so there are two other positions, one standing, leaning back, and then if you have something that you could lean forward onto, that can also be really helpful. And this is really good in terms of recovering from your breathlessness after performing an activity. So next we're going to talk about breathing control. And this is a really great way to gain control over your breathing, especially if you're having a sort of an acute attack of breathlessness, and also to engage your diaphragm, that muscle that's much more efficient in helping you breathe. So you can have a little practice of this at the moment. And what you can do, you're going to place one hand on your chest, the other on your tummy. You're going to close your eyes and help yourself relax and really focus on your breathing. You're going to slowly breathe in through your nose with your mouth closed. And I've just got a little picture there. You should feel your lower hand pushing, sorry, you can't quite see on my screen, but you should feel that lower hand on your abdomen pushing out, not so much the hand on your chest. So really trying to engage that breath from down within the lower part of your tummy. And then you'll breathe out through your mouth. And you want to try and use as little effort as possible and try and make the breath slow, relaxed, and smooth. And another really great way to manage breathlessness is the use of a handheld fan. Many people find using a battery-operated fan can be really helpful in controlling their breathlessness. And there is quite a lot of great research out there and research studies that have been done with patients that have breathlessness that has shown a cool draft of air from a handheld fan over the lower half of the face can be really effective in reducing symptoms. They're a great option because they're quite portable, they're quite affordable, and even sometimes if you haven't got a handheld fan, even just a freestanding fan or a desktop fan, or even opening a window and having a cool draft of air over your face can also be helpful. And some people even find just a cool washer on the face or a mist of water to also be quite helpful. So just to show you how to use the handheld fan, I've got just a little demonstration here as well. So usually it's really helpful for recovery, and it usually takes a couple of minutes to take effect. So you want to hold the handheld fan about 15 centimeters from your face and pop it on. And yeah, you want to be able to feel it on your top lip, and you want to just move the fan side to side so that the breeze covers the bottom half of your face. And you want to remember to use your controlled breathing that we just went through as well, and really try and relax your shoulders. So how does this help reduce breathlessness? You're probably wondering. There's sort of a hypothesized theory that what the fan is doing is that cool draft of air over the face, one of the nerves on our face, is being stimulated. And what it does, it tricks the brain into thinking that you're actually getting more oxygen than what you are, and it reduces that sensation of breathlessness. So it can be really handy, even just to pop in your bag and take with you when you need some additional assistance in managing and controlling your breathlessness. Where can you get one? Well, you can see on my screen here, we've got a beautiful fan that the Lung Foundation do sell on their online store. It's only $12 and with some postage and handling fees as well. So yeah, check it out on their online store. And we know that this fan has been sourced because it's been shown the design of the fan to be very effective in managing breathlessness. So the next topic that we're going to go through is anxiety, and we did touch on this a little bit earlier on in the talk. So how can anxiety affect your breathing? Well, quite often the symptoms of anxiety are very similar to those of breathlessness, and it can be quite difficult to differentiate between the two. We know that being anxious can make you think less clearly, and it can also make planning tasks and pacing yourself more difficult. If you are anxious, it becomes harder to spot the triggers that cause your breathlessness, and this can make it slower to use your coping techniques to help reduce your breathlessness. Being anxious also generally makes people more uptight or tense, and it can make the muscles around their chest feel quite tight. Also, anxiety can make someone focus more on their inability to breathe and get the air in, and this can increase breathlessness also. It might make you breathe faster and shallower, further increasing that breathlessness sensation. Oh, sorry, going back. And as you can see here in the diagram, you sort of become in this vicious cycle of anxiety. You feel breathless, which makes you feel panicked. The panicked, anxious feeling worsens your breathlessness. You start doing less, you feel more anxious and more short of breath. And that vicious cycle continues. Most people who have breathing problems do feel anxious and panicky at some point. And sometimes that sensation of anxiety and breathlessness can be really, really strong and overwhelming. But you can beat the feeling. And we're going to go through a few tips that can really help with that. Try and break the cycle of anxiety. So a few things that we can do to help manage the anxiety is stop what you are doing. If you feel that feeling come on, you want to try and break the cycle by removing yourself from the situation if possible. You want to try and manage negative thoughts and really tell yourself, I will get my breath back. You want to try and relax your shoulders, maybe change your position, using the positions that we spoke about before, those positions to help breathlessness, and also our breathing control. So really trying to utilize that relaxed breathing from our diaphragm. Self-talk, so really trying to, like I said before, remind yourself that this will pass. You will get your breath back, trying to talk yourself through it. Some people find relaxation techniques to be really helpful. It could be listening to music, sometimes doing some meditation, and the handheld fan again can be really helpful. Mindfulness. There are a lot of things out there, colouring books, CDs. Something that we have been using more in our pulmonary rehab here at RPA is actually phone apps. And there is one that we have used called Smiling Minds. And it's a really nice app that talks you through relaxing, breathing, and it's completely free and you can download it from the App Store. So Smiling Minds is a really nice one. And essentially, if anxiety is a big problem for you and you feel like you're just not getting on top of it, one of the best things that you can do is access some support. Talk to your doctor or your GP about getting a referral and really talking to a professional who can potentially identify some of your triggers and really try and help you overcome that. So one of the final aspects of breathlessness we're going to talk about is inactivity. And this is probably something that can be a problem for a lot of us. And it is a very easy cycle to fall into when you experience breathlessness. So what happens obviously when you feel breathless, sometimes you can become fearful of activity that makes you breathless. So then you start to avoid those activities. Inherently, you start to do less, and then your muscles become weaker. And as we mentioned before, weaker muscles use more oxygen and they use it much less efficiently. So therefore, you actually start to feel even more breathless. And the cycle continues. And what we really want to reinforce is that you don't want the feeling of your breathlessness to stop you from being active. And how we can stop this cycle is to maintain regular physical activity and to keep our muscles working. This is not always easy, but it is very possible. And even if you're currently doing very minimal physical activity, you might be doing absolutely nothing. You can get improvements, and you can start very small and slowly build your muscle capacity. And this can create changes within the muscles to use the oxygen that you do have much more efficiently, in turn making you feel less breathless. Even though you can't change what's happened in your lungs, it's amazing what the changes to your muscles can impact your breathlessness. And one of the best ways to achieve this is through pulmonary rehab. So hopefully some of you have heard about pulmonary rehab. Some of you may have been to pulmonary rehab and completed the program, or you might be waiting to attend, or some of you may never have heard of it before. So I thought I would talk through what it is and how it can be helpful. So pulmonary rehab is an 8-week program of exercise, education and support. The exercise component focuses on increasing your physical function. It's individualized, and we also cover your safety considerations that you might have to ensure that you're on track to achieve your goals. I've got some pictures here actually of one of our lovely pulmonary rehab patients who gave her permission to be shown during the presentation today. She does have ILD and has completed our pulmonary rehab program. Just to give you a bit of an idea of what we would do in the gym. So the exercise component is aiming to build up the muscle strength, and also the muscle's endurance and the ability to use more oxygen more efficiently. And hopefully with that increased endurance, your aim is to be able to do more and to go for longer. And this can be really beneficial to your quality of life. The education component of pulmonary rehab really aims to target on building resilience to breathlessness, and also going through all of the coping strategies that we've mentioned today, and really getting you confident in managing your symptoms. So how do we know that pulmonary rehab works? Well, luckily there's actually been a lot of research into pulmonary rehab, and even specifically in patients with ILD. And what the long-term outcomes have shown is that patients can achieve an improvement in their quality of life, a reduction of their breathlessness, an increase in their exercise capacity, which results in the ability to exercise or perform daily tasks better than before, and also a better management of your emotions. And I thought I might also mention, at the moment, we're going through a very strange period in the last 6 months with COVID-19. And this has actually changed a lot of how we perform our pulmonary rehab at the moment. And some of you who were attending a program, you know, it may have stopped because of the coronavirus, putting restrictions on exercising in groups, in a hospital gym, but also, you know, being more socially isolated and not wanting to come out and probably rightfully not wanting to come out and protecting yourselves. So something that a lot of hospitals I've noticed have been offering, and we're definitely doing this here at RPA, is tele-rehab. And basically it's a pulmonary rehab program over the computer, just like what we're doing right now. And we're still providing exercise, education and support. It can be one-to-one, or there are group sessions that we've been doing here as well, to try and keep our patients moving forward. And it's actually been really successful so far. A lot of people have been finding it really helpful. So definitely still, if you are keen to go to pulmonary rehab, still get referred, because a lot of hospitals are offering this alternative model at the moment that you still can gain a lot of benefit from. Oh, and just here's a picture of how we've been doing it in our gym with our students. As you can see, we've got one down there with the computer, and there's our classes on there, and they can all see each other, and they can obviously see us. And then we've got the two therapists demonstrating the exercises where the patients would follow along. And obviously it's quite different. We're very restricted in space to just the computer screen and obviously in equipment, but there's still a lot that you can do with very little. So yeah. And my final slide on breathlessness is just, I thought it would be important to talk about how we measure breathlessness as well. So some of you may be familiar with the Borg scale, especially if you've been attending the ILD clinic and you've done a 6-minute walk test with the physiotherapist. And what this is, it's a rating scale of breathlessness out of 10. And I'll just show you what it looks like here. And why I thought I would mention it is that it can be really helpful in being familiar with this scale to keep track of your symptoms in terms of monitoring, and also to guide your exercise and your physical activity. And it is important that during activity and exercise, experiencing some breathlessness is okay. In fact, it's completely normal. We all feel breathless when we exercise. And to give you a guide of what we would educate our patients on in rehab is that you want to be aiming for a 3 to 4. So moderate to somewhat severe breathlessness with exercise. You don't want to be pushing into breathlessness that is of discomfort to you and causing you distress, but you also want to be achieving some breathlessness, so your intensity of exercise is going to give you the benefit. So I just thought that this could be quite helpful in remembering that some breathlessness with exercise is okay, but just to keep an eye on it so you're not pushing into discomfort. All right, so we're going to move on now to cough. And our first slide on cough is going to be talking about why you might be experiencing a cough with ILD. And again, it's very complex. The exact cause of dry coughing in people with pulmonary fibrosis is not entirely understood. We know that a chronic cough can range from a nuisance to some people to actually being really significant and interfering with daily activities like sleeping, eating and talking. And it can also lead to fatigue and more shortness of breath. It is believed that the coughing is due to the scarring in the lungs. And one theory is that the fibrotic process in the lungs may cause the airways to have an increased sensitivity to cough-inducing substances. But it's also multifactorial. There are probably a lot of other things that could be influencing cough as well. It's quite complex. So the effects of a chronic cough, like I mentioned just then, can be quite varied, but it can cause problems with sleeping. It can also cause pain, especially if you've got a lot of heavy coughing, pain of the chest, of our ribs, of our muscles. It can also cause difficulties within relationships, avoidance of public areas, Especially at the moment where there's a fear of cough and COVID-19, it's really impacting these people even more. It might cause decreased social interactions and work-related problems, and all of these things can affect physical, mental, and social health. And also the social impact of chronic cough can further compound limits exercise ability, reduces our walking distance, and also can lead to the use of supplementary oxygen. So how can we help to manage the symptom of cough? Probably one of the first things that is important to consider is ruling out other causes of cough. It can be caused by more than one condition. And for example, certain medications can contribute to cough, postnasal drip, allergies, and reflux disease. So definitely talk to your doctor about your cough symptoms and make sure that, you know, other conditions on top of your ILD can also be considered. The next important step is to identify triggers that lead to your cough. You want to keep track of your cough to see when it's worse and note what triggers you might have been exposed to. Some things or known triggers that can bring on cough in people with ILD are talking. It could be exposure to certain types of weather, like extreme heat or humidity. It might be irritants in the air, such as smoke or perfumes. And in some people, exercise or sort of overexertion can also bring on cough. And what you want to do, if possible, is to avoid future exposures, but this is not always easy. The next point is about cough control, and there are a few certain elements that we can do to assist with this. So like I said just then, is, you know, trying to avoid triggering factors, not always easy. Take care when speaking, so avoiding long sentences or taking breaks while speaking. Keeping your throat moist, drinking plenty of water throughout the day, keeping hydrated. Taking your time when being physically active and avoiding that overexertion. Trying different breathing exercises which can slow down your breath and help to reduce that urge to cough. And some people also find sucking or chewing lollies can be helpful. And what that can do is inhibit the cough reflex a little bit. The next point on cough that I wanted to talk about is something that is actually very common, but maybe not spoken about very often, and that is urinary incontinence. Chronic coughing, we know, can contribute significantly to the risk of bladder leakage, and this is also called stress urinary incontinence. The reason why this is, it essentially comes down to physics. It's the result of greater downward force on the bladder, which is caused by a cough, and that force is greater than the closure of the force of the muscles that hold the urine in the bladder. And what happens with the chronic coughing is that you can end up straining and weakening the pelvic floor muscles. What these muscles are, they're sort of a sling-shaped muscle that are suspended from your tailbone at the back to the pubic bone at the front, and then also across your sitting bones. And what these muscles do, they really hold up your intestines, your bladder, your organs of the pelvis, and they also help to close off the bladder and the rectum when we need to. So what happens is with chronic coughing, you end up straining and weakening these pelvic floor muscles, hence why people get urinary incontinence. And we know that urinary incontinence can really impact on our lives greatly. So what can we do about it? There are a lot of great research projects that have shown consistently that strengthening our pelvic floor through some specific exercises, and those exercises must be done correctly, it can reduce the stress incontinence. And it's really important to remember that having some bladder leakage is actually not normal, and it's very treatable. So it's really important that you speak to someone about it. Here's just a diagram that sort of just reinforces what I said. You can see there's two bladders here, and these bladders have a weakness of the pelvic floor. You can see at the bottom, the sling underneath the bladder is sagging and it's not supporting the bladder very well. And the neck of the bladder at the bottom is also coming through the pelvic floor and it's not being supported and closing properly. So as soon as you get a downward force like a cough, you're not getting a good muscle action of the pelvic floor and you're getting leakage of urine. So like I said, one of the best things you can do is to strengthen the pelvic floor muscles, but it isn't easy. It's quite hard to get a good contraction of those muscles. And probably essentially the best thing that you can do if this is a problem for you is to speak to your doctor and get a referral to a specialised women's or men's health physiotherapist who are trained specifically in strengthening the pelvic floor muscles and treating incontinence. So definitely if this is a problem for you, I would be going to see one of these specialist physiotherapists. So the next topic that we're going to move on to is managing a cough that actually has phlegm or sputum. And some people do have a cough that's dry, but others actually do have a productive cough. So when they cough, they bring up mucus, phlegm or sputum. There are some conditions that can contribute to this, and that is bronchiectasis, COPD. And even though you may have a cough that always has some sputum production throughout the day, it's really important to establish what is normal for you and what is a change. And sometimes a change could indicate an infection. And it's really important to identify the signs of infection early. What these might be is a change in your cough in terms of the colour of the sputum. It could be the taste, it could be the volume might increase. You might also be feeling generally unwell, having fever, aches or pains. If this is the case, you definitely want to see your GP really early so you can get prompt treatment, and you also want to get them to take a sample of your phlegm to make sure that you ensure that you're on the right treatment. And not always GPs do this, so this is really important to just see what infection you might have. So one of the best things that you can do when you have a cough with sputum is clear your chest regularly, because when we aren't clearing our chest and the phlegm is staying within our lung, you have an increased risk of developing an infection. And also having that extra phlegm within your chest, it makes it harder for you to breathe. So what we can do to help this is perform what we call the active cycle of breathing technique. And what it is, it's just a breathing exercise that will help you clear your chest. What it involves is relaxed breathing, so just normal, gentle breathing, deep breathing, where we aim to get air behind phlegm to help it shift, a huff, which is going to help clear the phlegm, but also at the same time avoid too much coughing, because the more that we cough, the tighter our airways will get and it'll be much harder to shift the phlegm. And then when we do finally come to a cough, it should be very easy to clear. If not, you may have to keep going with your breathing exercises until it shifts a little bit more. So I thought what we would go through now is a bit of a demonstration, and I've got some lovely students here where I'm going to get one to have a seat for me, and we're going to go through how we would perform this active cycle of breathing technique. So for today, if everyone can see, this is Edmund, one of our physiotherapy students, and I'm just going to instruct him, and he's going to demonstrate how we would go through this cycle. So for the purpose of today, you would want to be sitting comfortably in a chair, and we're going to start with our relaxed breathing. So Edmund, I'm just going to get you to take 5 normal breaths, just relaxing as you would normally breathe. And this is actually really important to perform because it's actually relaxing your airways and reducing any tightness that you might have within your chest if you have just had a coughing fit. And if we have nice relaxed airways, the phlegm is going to move much more easily. So then we're going to move on to taking 5 deep breaths. And Edmund, I'm going to get you just to place your hands on your chest there. And how we're going to do this, we're going to take a nice deep breath in through our nose. We're going to hold it for 2 seconds. And then we're going to let it out through our mouth. And why we hold it for that 2 seconds is what we're going to aim to create is a little bit of back pressure within our lungs. And what this does, it aims to try and get air behind sputum to help it sweep up towards our central airways. So you can see Edmund's doing a really nice job there. We're only going to do 5 in a row because we don't want to get dizzy. Beautiful. You can really feel that air going right down to the bottom of the lungs. And well done, Edmund. And then you're going to go back to relaxed breathing. Like I said, you don't want to make yourself feel dizzy from taking too many deep breaths in a row. And it's so important for those airways to stay nice and relaxed. And as we move through the cycle, we're trying to create this sweeping movement of sputum, slowly moving from down towards the base of our lungs or out in the periphery, closer to the central airway. So when we come to cough and clear, it's much easier and we're really clearing the whole lung. So we might now move towards the huff. And I've got here for Edmund what we use here in rehab with some of our patients with phlegm. And that's just a little tube, but you can perform your huff without it. Just for today's purpose, we'll use it because it can just be really helpful in getting the right technique. So I'm going to get Edmund to demonstrate to you a huff. And basically what that movement is that we're going to be performing is we're going to keep our mouth open and we're going to breathe out like this. And it's almost like you're trying to fog up a mirror or fog up a glass. And what that's going to do, it's going to try and squeeze the phlegm even closer. So when we cough, it's much easier to clear. Do you mind just demonstrating that huff, Edmund? Good. So it's a slightly deeper breath than normal and a short, sharp breath out. Beautiful. Usually we would do about 2 to 3. And if you're doing it quite effectively, you may actually hear those secretions starting to rumble or gurgle closer to your central airway. And then really the cough should be just to clear. You shouldn't have to cough and strain overly to get the sputum out. If you are, you may have to repeat the cycle to move it that little bit more. All right, thank you very much, Edmund. So with our active cycle of breathing technique, there are specific timings of medications and also specific positions that may assist with the breathing technique. And really probably my strongest recommendation is that if sputum is a really big problem for you, to get the most individualized or sort of specific treatment that's going to help you in the best way, seeing a physiotherapist for guidance can be really beneficial. Especially if you have got an infection or you've been getting a lot of infections recently and a lot of difficulty with clearing your chest, seeing a physio can really help in getting over the infection and also setting you up with a program to hopefully reduce the risk of a future infection. A few quick safety tips when performing your airways clearance. Never perform if you have pain. If you are having pain when you're doing it, definitely let your doctor or physiotherapist know. You should never feel dizzy when performing the exercise. You should probably avoid directly after eating, as it might increase the risk of vomiting or reflux. You want to avoid uncontrolled or over coughing, as we know that this is not helpful and it actually makes it harder for you to clear the phlegm. And if in any doubt, or you really want, an individualized program that's specific to your problem, contact a physiotherapist for guidance. And then finally, there are certain devices that can be helpful in clearing phlegm also. Some of you may have seen or may even use some of these breathing devices. They work in many different ways. Some provide vibration. Some provide a bit of resistance. And essentially what they aim to do is to help you clear the phlegm more easily, whether it's reducing the thickness or getting air behind plugs. And really the only way to know is to speak with a physiotherapist and really find out what's a problem for you, and then potentially they may help guide you in finding the correct device and also teaching you how to use it in the correct way. So that takes us now to the end of the talk. So in summary, just to wrap it up, breathlessness and cough are two of the most common symptoms experienced by people with ILD. And despite not being able to reverse the fibrosis in your lungs, there are so many ways that you can help manage your breathlessness and cough. And hopefully through the webinar today, you may have found some ways that you haven't thought of before that could be really helpful for you. Also, pulmonary rehab is one of the best ways to improve self-management of these symptoms, improve your function and your quality of life. So definitely ask your doctor about getting a referral and attending a program if you feel like you would benefit. And yeah, thank you so much for listening. And now we will hopefully have some time for questions. Thanks, Brigitte.
Okay, thank you, Amanda. Oh, look, that was so comprehensive, and we're really fortunate to have somebody of your experience joining us today to share your insight. So thank you very much. I hope those joining in online with us today were able to take something away from Amanda's great practical advice there, and maybe have a few new ideas to try at home now too. So that does bring us to the Q&A segment of the webinar. And I can see that we do have a few questions coming through already, which is great, so I'll get to those in a moment. Before we get started, I'll just remind you that responses to these questions are of a general nature only, and we would certainly still recommend you seek advice from your treating healthcare team further to any of the general advice discussed here. So I'll just go to our first question, Amanda. Somebody is talking about their shortness of breath and panting, and wondering if there's any factors that increase the likelihood of inducing an episode. Recently, this person has experienced more episodes and seems to be triggered if they go into a room that's a bit cooler.
Oh, okay. Yeah, look, sometimes, like we spoke about, there can be certain irritants to people's airways. And that could be colder or drier air can make people feel more breathless or just make it harder for them to breathe. And I think probably a lot of these management techniques can be really helpful. Potentially even, a little handheld fan, but also just positioning and breathing control. And look, it's very hard to avoid, you know, environmental factors like colder air. It can be really tricky. But yeah, look, I think it's just trying a few different things to see what's going to help. If possible, avoiding that really, really cold air. And yeah, but it's a tricky one. I think it's definitely about trying different things to see what is helpful. Yeah.
Okay, thank you, and I hope that gives the person who asked the question a little bit of something to go off. I think that's great. Second question for you, Amanda. What signs might I experience that could mean my PF is getting worse, and when should I get a review by a specialist or a physiotherapist?
Yeah, no, that's a really good question. And definitely, I think in terms of monitoring symptoms, so if you do notice that your breathlessness has consistently changed, so worsened, you may be feeling more breathless over, you know, a period of some time. And if that's not sort of, you know, sometimes it's normal to have a good day and then a bad day.
Mm-hmm.
And then hopefully, you know, you might feel a little bit more normal in terms of your breathlessness, you know, the next day. But if it's a consistent change in your breathing, definitely you want to contact your doctor and let them know. And this goes for cough as well. If you notice a consistent change in your cough, especially if there are any signs of infection, you want to get in touch with your GP or your specialist quickly and let them know, because usually they will, you know, they'll make contact and further ask questions about the change or sort of, I guess, in your normal symptoms. And if they are concerned, they'll make an appointment. But no, very good question. And I think it's always, you know, any change that sort of stays and it's not going back to what it was like before, you should let someone know.
Okay, great, thank you. I'm conscious of the time here, so I think we can just squeeze in one more question. There's somebody wanting to know whether or not a cough syrup would help at all.
Oh, that's a tricky one. Look, I don't think there's any overwhelming evidence to show that a cough syrup can be overly helpful. But look, some people might find that it does help them, and obviously everything is different for different people. But because that is a medication, I would definitely get advice from either your pharmacist or your doctor. Because unfortunately, being a physiotherapist, we don't give advice on specific medications. So yeah, I would definitely speak to your pharmacist or your doctor to get further advice.
Okay, great, thank you. And I think with that brings us to the conclusion of the session. So thanks to our speaker, Amanda. We so appreciate you taking the time to join us and share some of your knowledge and insights with our community. Thank you.
My pleasure. Thanks, everyone. And yeah, all the best. Good luck. Thanks, Brigida.
And thanks also to our partners at the Centre of Research Excellence in Pulmonary Fibrosis for your support in this webinar series as well. I will just let you know about our upcoming pulmonary fibrosis webinars. So the second instalment in the series is scheduled for the 10th of September. Associate Professor Nicole Goh will address the importance of palliative care in pulmonary fibrosis and look at destigmatising the concept of advanced care planning. We also have a session around updates to treatment and managing pulmonary fibrosis presented by Greg Keir. Now, this one was originally scheduled for earlier in the year, and we will let you know when a new date for that one has been organised. So I do hope everyone listening was able to gain some insight from today's session, and please know that if there's anything further that you are needing help with, our Information and Support Centre is ready for your call, so please get in touch with us via those details down the bottom of your screen there. We do have a number of resources for people living with pulmonary fibrosis as well, so we really encourage you to explore those on our website too. We do also, as you can see up on the screen there, have a telephone-based peer matching service for people affected by pulmonary fibrosis called Peer Connect. So if you're living or caring for somebody living with pulmonary fibrosis and you feel you'd benefit from connecting with a peer, please get in touch with Lung Foundation via the Information and Support Centre details there too. And that brings us to the end of the session today. So thank you again to everybody who tuned in live and to those watching the recording later. Please look after yourselves and each other, and we'll see you next time. Bye for now.